Addiction is often oversimplified as a lack of willpower or moral failing. Still, in reality, it is a complex and multifaceted disorder that can ensnare individuals regardless of their background or personality. It's a chronic condition that intertwines with the very fabric of human biology, psychology, and social environment. In-depth definition of addiction. Addiction is a chronic, relapsing disorder characterized by compulsive drug seeking, continued use despite harmful consequences, and long-lasting changes in the brain. It is considered both a brain disorder and a mental illness. Addiction is about more than just substances. It can also manifest in behaviors like gambling, eating, or even internet usage, where the behavior becomes compulsive and interferes with ordinary responsibilities and concerns. The brain on addiction. At its core, addiction involves a hijacking of the brain's reward system. The initial decision to take drugs or engage in an addictive behavior is typically voluntary. However, repeated use causes changes in the brain, impairing self-control and interfering with the ability to resist intense impulses to take drugs or engage in the behavior. Causes of addiction. A closer look. Understanding the causes of addiction is essential in developing effective treatment and prevention strategies. Here's a more elaborate exploration of the causes. Genetic factors. Studies suggest that genetics account for about 40 to 60% of the susceptibility to addiction. Certain genetic traits may predispose individuals to addictive behaviors. Neurobiological factors. The interaction of neurotransmitters and brain regions plays a crucial role in addiction. Drugs and addictive behaviors can overstimulate the system that registers pleasure in the brain, creating a powerful, positive reinforcement for the behavior. Psychological aspects. Mental health issues such as depression, anxiety disorders, and schizophrenia are often linked with addiction. For some, addictive behaviors serve as a coping mechanism to alleviate symptoms of mental health disorders. Environmental and social factors. Family dynamics, peer pressure, cultural and socioeconomic factors significantly influence addiction. Exposure to drug use at a young age, lack of parental supervision, and social environments that condone drug use can increase the risk of developing an addiction. Trauma and early life stressors. Individuals who have experienced trauma, particularly during childhood, are at a higher risk for addiction. Traumatic events can lead to emotional pain, which some may attempt to alleviate through substance use or addictive behaviors. Developmental influences. The earlier drug use begins, the more likely it will escalate to serious addiction. This is partly due to the fact that the brain is still developing during adolescence and early adulthood, making it more susceptible to the harmful effects of drugs and addiction. The health impact of drug addiction. Drug addiction is detrimental to physical and mental health, often leading to a range of serious conditions and complications. Physical health consequences. Chronic drug use can lead to cardiovascular diseases, liver damage, respiratory distress, and a host of other health issues. Intravenous drug use significantly increases the risk of infectious diseases like HIV and hepatitis. Mental health disorders. Substance abuse is closely linked with mental health disorders such as depression, anxiety, and schizophrenia. Drug use can exacerbate these conditions, leading to a vicious cycle where drugs are used as a coping mechanism. Neurological impact. Drugs can alter brain function, affecting areas responsible for judgment, decision-making, learning, memory, and behavior control. This can lead to cognitive impairments and reduced ability to control impulses. Addiction and overdose. The risk of overdose is a constant threat in drug addiction. Overdose can result in permanent health damage or death, adding to the gravity of addiction's health consequences. Financial implications of drug addiction. The financial toll of drug addiction can be devastating, both for the individual and their family. Cost of substance purchase. The ongoing expense of purchasing drugs can lead to financial ruin. Addiction often leads to prioritizing drug expenditure over essential needs. Employment and productivity loss. Addiction can impair work performance, leading to job loss, reduced income, and diminished career opportunities. Healthcare expenses. The health complications arising from addiction can result in substantial medical bills, further straining financial resources. Legal and societal costs. Legal issues related to drug use, such as fines or incarceration, can compound financial difficulties. Additionally, there are broader societal costs related to increased healthcare usage, crime, and lost productivity. Conclusion. Addiction is a disease that affects both the brain and behavior. The path to addiction is complex and unique for each individual, woven from a tapestry of genetic, neurobiological, psychological, social, and developmental threads. Understanding these intricacies is paramount in destigmatizing addiction and creating effective treatments that address not just the addiction itself but also the underlying causes. As we continue to unravel the complexities of addiction, we move closer to a world where this condition is treated with the empathy, care, and effectiveness it demands. The effects of drug addiction extend far beyond the individual, impacting health, finances, families, and communities. Understanding these repercussions is crucial in highlighting the need for comprehensive treatment strategies that address not only the addiction itself but also its wide-ranging consequences. By tackling addiction, we can alleviate a significant burden on individuals and society, paving the way for healthier, more stable lives.